Well, I certainly don't agree with the idea of paying for another country's health insurance. It's a tough question, what you're asking me. And I've thought of this many times in my career over the years because, you know, we're dealing with the third-party insurance in the people I treat, you know, and initially that was the majority of the pay we got came from a third party. Now it's about half. So, you know, maybe we're moving in the right direction, I don't know. But, you know, we just heard news that Donald Trump, it was on Rand Paul's website that insurances now are allowed to cross state lines, which means competition, which means there's going to be cheaper policies for people who don't have health problems, which is going to make it more expensive for people who do. So over the years, I thought about this and I go, what's the right answer to that question? It's not an easy thing to answer. If we say no insurance starting today, there will be people that die because they can't afford their treatments. However, that wasn't too far back that was the case in the whole country. Before World War II, hardly anybody had insurance. I don't think, you know, there was very elite people who were the only ones that had insurance. So what did people do before World War II? Well, they took care of themselves. They made sure they knew what they were putting in their body. They made sure what they were putting in their body was good, wholesome food. They took care of themselves. They tried to go to the doctor when they thought they needed to, and they stayed away from hospitals because most people died in the hospitals. You talk to any old person. My grandmother said that. I'm not going to a hospital. People die there, right? So it's a scary thing. You know, if we did put that harsh wall in place, no more insurance for everybody, yeah, there would be a lot of upheaval in the country, but then all of a sudden you would see people going, oh, then I better take care of myself. I better start taking responsibility for my health because there's no safety net, right? So people would do that. It's probably a blend of different things that would solve the problem, like maybe giving everybody catastrophic insurance. You know, if you get hit by a car, and you know, there's got to be some coverage for that, or something where we don't necessarily have to have the insurance the way it is. I mean, to insure people that aren't even part of this country, that's not fair. And to insure people for, you know, I don't know, I had a relative that went to Narconon, and although there was some insurance coverage, most of it had to be paid by me. And I was willing to do that because I wanted to help out my family member, and I knew he made some bad choices, which started with a prescription and went down the opioid path. And luckily, he appreciated it enough to keep himself clean, and now he's helping others do the same thing, working at Narconon, which I am very, very, very thankful for. He's a great person. It's not an easy question. I just know that the way things are is so wrong. The problem with insurance in this country is everything leads to a drug. You know, you got chiropractors working on people with the most common ailment they have, back pain. And they're lucky to get, you know, they're saying, oh, people have a $3,000 deductible, and my bill doesn't even get up to $3,000, so nobody's going to come to me because I'll have to pay out of pocket. And then you turn around and you look at Abilify, a drug like Abilify, one pill, or one bottle of 90 pills being reimbursed by Medicare at $4,200 for the bottle. I mean, how's that even fair? You know, or a surgeon goes in and does a knee surgery, and he's in there for whatever, and he's, by Medicare, is being paid $850, but the bill is like $75,000 because they're charging a facility fee every 15 minutes. It's $20,000. You know, so yeah, what's happened is the system we have has become so corrupt that you pretty much got to drain the swamp. And, you know, if you're going to drain the swamp, you got to get somebody in there that nobody's going to like, because nobody's going to like the person who does that. And you got to get a person who doesn't care if anybody likes them, which is kind of what we have. You know, so not an easy question to answer. I just know that it's so corrupt. If Americans knew what was going on behind the scenes, they would be totally dismayed. I don't know if it would ever nullify it, but certainly it has to start with taking responsibility. It has to be, the patient has to take more responsibility for their health. I remember when I first got into practice, I tried to explain to somebody why they had the problem. If they had good insurance, I had people saying, I don't care, just whatever you got to do, just get me out of pain. Like it wasn't even their problem. You know, and then if something I did didn't have the immediate effect, they were mad at me, like I gave them their back problem. You know, and that wasn't the case. They had it when they came in. And a lot of times what I noticed is people have an injury and they don't have the real effects of that injury for 20 years. And then 25, you know, 2 decades later, 2.5 decades later, all of a sudden this pain comes out of nowhere, and they don't relate that to the old injury they had, which they never took care of. You know, because what they're usually given when somebody has an injury is pain medication. That doesn't fix anything. they got to actually go through the mechanism. If they've damaged tissue, they got to retrain the new tissue to perform like the old, or they're going to have a problem. And that's what happens. So yeah, more education, more responsibility by the patients would be a great start, because that would start to lower our overall healthcare costs pretty tremendously. You know, there was interesting, some statistics you can look back in history, and times when the worst profession to go on strike health-wise is trash removal, because disease spreads like crazy. When you don't get rid of your garbage and it starts to build up in the cities, that is the most important health aspect we have in our country. When doctors have gone on strike in the past, a lot of times the health rate dropped. I mean, the death rate dropped. And it's because a lot of what they do, although a lot of times they're saving your life, what they do can cause you to die as well. I mean, side effects of drugs and side effects of surgery have a lot of peril with it. So we do need to change our responsibility level on health. We do need to understand what gets us sick and what doesn't get us sick. Most Americans I meet are chronically dehydrated. They don't even know it. And that can cause all kinds of things, from heart disease to intestinal problems, and becoming toxic just because you're not hydrated enough. Simple little test. Pinch the skin in your hand and watch it go back down. And if it goes down slow, you're dehydrated. I've done that to thousands of people, and 75% of them fail the test. Yeah, so more responsibility. That's where we got to start. Educating the public. It's not like they don't want to take care of it. They just don't know. They're being told a lot of false information. I think America's waking up to that because of the reach for stem cells. People are educating themselves in spite of what's being said on the internet, in spite of the scare tactics by the government, in spite of the scare tactics doctors are falling for. The patients are not. The patients are realizing, nope, my friend got it, it worked, and I want it too. So, education. That was paid for by food lobbies. So the pyramid's upside down. Recommending as many carbohydrates as they recommend is why America gained 35 pounds in the last 30 years. It's why we have heart disease and diabetes, and we're just the most overweight country in the world because of that food pyramid. That's got to be changed. But I will tell you, where the education started coming into play is where deductibles and co-payments went up, because people now have to pay. They have skin in the game. And I got to pay $15,000 out of pocket for that knee replacement surgery, and this stem cell injections only cost me $4,000 or $5,000, and there's a much higher success rate with that than with this. Why would I do this first when I could do this? This might help me to save over $10,000. Not quite. It gets a little more convoluted than that. So you got to realize the doctor you're going to is probably getting audited, because there's been more audits. There was a bill, part of Obamacare, or the National Affordable Health Care Act. The first part of that enacted was that insurance companies cannot make more than 15% profit, which on its face is a good thing. But what it said in the fine print was, but the insurances can audit the doctors, and if they recover money in an audit situation, that is not considered profit of that company. So if they want more than a 15% profit margin, they have to audit the doctors, and they do. So there have been more audits to medical doctors and chiropractors and physical therapists in the last 10 years than there have been in the previous 30. So the doctors have to make up for that loss somewhere. So the doctors are looking for these services, and that's what we hear a lot. What's the service to do to make a lot of money? Like, yeah, you want to make a lot of money? Get people well. That's what's valuable to people. People pay cash for it. It's not... what a lot of doctors, unfortunately, are trying to play is the shell game. Well, they took all this money here, so I got to get some sort of service that recovers that money. And unfortunately, a lot of doctors are looking at stem cells that way. I'm not. I'm saying stem cells is something that could help catch somebody up from that 20 years of no symptoms but degeneration, and might give them more use out of that joint for another 15, 20 years at a very low cost. And that's what we've seen. We've seen people coming in with just amazing results when we start injecting with stem cells and doing a rehab program with them at the same time. Rehab with the combination of chiropractic, physical therapy, and medical services like injections and bracing. And when you do that together, people are going, this is the best thing that ever happened to me. I feel like I did 25 years ago. So it's a matter of, when they have to pay more out of pocket, they have more skin in the game. So that's all part of it. You got to realize that the doctors are being assaulted by these drug companies left and right. If a doctor makes a deal to lower the amount they have to pay in an audit, that puts them on a list to be audited more, because they know, well, if we ask him for 500,000, he'll negotiate to 200,000, and that's what we really want. And that's what they're doing. You know, insurance companies they break the law quite a bit. Most insurance companies are not medical authorities. In fact, I would say all are not medical authorities. They may have a medical person on their board, but that doesn't mean they're a medical authority. They are actuaries, basically. And they have a fiduciary agreement with the patient. That's the contract with the patient. The patient says, I'm going to get sick. The insurance company says, no, you're not. We'll be willing to bet. You give us so much a month, or get your employer to pay us so much a month. If you do get sick, we'll pay the bill. But they had no control over it. So the patient would get sick and go to the doctor, and the doctor would treat him, and the bill would go in, and they'd have to pay the doctor. They started bullying doctors, so there was a law passed called ERISA, the Employee Securities and Retirement Act, or something. I don't know the exact acronym, but that's federal law, and they govern insurance companies, and they protect doctors and patients from the bad doings of insurance companies. And up until that point, you know, insurance companies had no real authority over the doctor. So to get out of ERISA, which says they have to pay within 30 days, and they can't audit beyond that point, to get outside of that scope, they get the doctors to sign a state contract, which is called being in network. And they basically try to create a network that says, if you're not in our network, you're not going to get patients. And they market to the patients, oh, going to a doctor in network's better, you have a lower payment, lower overhead, lower out-of-pocket. But that's because they know that the doctors in a network, one, they're going to reduce the average rate of what they're being reimbursed, and two, they're going to get a lot of that money back in an audit situation anyway. Well, that's the way it was when I first started, and then they came out with HMOs, and it got really upside down, and then HMOs, except in a couple parts of the country, pretty much went by the wayside by public disapproval. And so they came out with networks to say, okay, you can go outside your network, but being in network's better because. Yeah, I mean, if we wanted to get rid of the networks, we just got to get the doctors strong enough to say, I'm not going to be in your network. More and more doctors are becoming that way because stem cells are cash, and they don't have to be in any networks to deliver them. And I think it would be a real crime to make stem cells covered, because if they were covered, then the insurance companies would start to manipulate them, and the drug companies would get involved, and they would try to make it more profitable for them and not for anybody else. I do hear that there was a drug that just came out based on stem cell technology that is $500,000 a use. Yeah, something like that. I don't have the details, but I just heard that, which is a crime. So, you know, the way our healthcare system is pretty manipulated and pretty controlled and pretty much driven for profit. We need to get back to what's good for people and not what's good for companies that are delivering it. Doctors do deserve to get paid well. If they keep people well and healthy, they do deserve to get paid well. I mean, nobody wants to go to a cheap doctor. Everybody wants to go to the best doctor. But, you know, they also need to, I think the days of doctors ripping off the system on a regular basis or making lots of money, that doesn't exist today. Most doctors are scrambling to cover their bills, which is why a lot of medical doctors are dropping out of healthcare, because they're not making any money at it. And when surveyed, at I think it was 12,000 family practitioners, 94% of them said they'd never do this career over again. So things got to change. Public awareness is the main weapon to use. The more aware the public is, the more strength the doctors have and the less strength the drug companies have. Well, if you look at areas like blue zones are areas around the world where people routinely live to be over 100 years old, and they're still viable, they're still vital, they're still living life. One of the common threads of all those blue zones is they eat very natural foods and they consume virtually no medication. Yeah. So if we all started to, you know, one of the things is we got to make sure that the people who are approving our foods are not the people who are benefiting and approving the drugs that we sell when our foods make us sick. And that's not the case in this country, you know, and I think that needs to be changed. And I think that when there's governing agencies overseeing things in healthcare, and they're using experts from the pharmaceutical industry because they're, quote, the smartest people on earth, you know, that's a very biased way to do things. You can't have drug people overseeing the drugs to make sure they're safe and effective, you know, when they're making billions of dollars off these drugs. But that happens in this country. We need to change that. There's a lot of things we need to change. But the first thing, everything starts with public awareness. It's a naive public that allows all this to occur. And the internet could be very useful in that. The internet could be also very, you know, the internet's the Wild West. You know, who wrote what you just read online? Who knows? Yeah, it's hard to do it. I mean, but instead of reading the conspiracy theory, you just got to look and see what's happening in Washington. So who has the largest lobby in Washington?
I think oil, food, and pharmaceuticals.
That's right. So, I mean, you know, if they have the biggest lobby, if they're the ones giving the most money to the lawmakers, well, then maybe we got to clean the swamp.